improvement of hospital breastfeeding rates in a tertiary care center, a quality management study. Childbirth is a defining opportunity for dual existence of both baby and mother, and breastfeeding being universally relevant, if successfully implemented, reduces the healthcare cost by about 875.84 crores and has an impact of preventing more than 1 lakh child deaths every year. In the current world, when the market-driven commercial milk formula industry violates the WHO International Code for Marketing, India still scores a low of 45 out of 100 in infant and young child feeding policy. And as per Ministry of Health and Family Welfare, early initiation of breastfeeding in the state of Chhattisgarh stands only 47.4%. Currently, with increase in institutional births, the opportunity for action lies in the healthcare facilities. Hence, with an objective to review and analyze the current breastfeeding rates and to develop a multimodal approach to enable, improve and sustain exclusive breastfeeding, this quality implementation process using WHO's revised guidelines of 10 steps of implementing BFHI was taken. This is the methodology we followed: filling an application for registration, completing initial assessment checklist, implementing corrective protocols, and finally an external assessment before qualifying for accreditation. Based on initial assessment checklist, we implemented the Focus PDCA tool to identify the focus areas for improvement. There was need for monitoring the current database in Excel format, tracking the feeding practices, observing the competency of nursing staff, and need for monitoring IMS Act implementation. To address the same, Hospital Breastfeeding Committee with designated nodal officer and core team members were identified. This team set out specific objectives of BPNI database monitoring in labor room, strengthening the use of tools and charts, facilitating early latch-on, realigning rooming and lactation support units, and developing a mechanism of antenatal and institutional follow-up for lactation support services. On analysis of manpower, methods, material and environment for possible areas of improvement, we found that there is a need to intensify the training to facilitate immediate skin-to-skin contact in labor room. We also needed to configure the BPNI database monitoring system in the digital portal of labor room. The documentation of latch-on and use of WHO standardized formats were started. Realigning of NICU as lactation support rooms, rooming in and KMC units was done. We selected the clinical, educational, operational data collection and supportive tools so as to have maximum impact on the areas identified, and we planned this change by intensifying IYCF skill trainings, by written institutional commitment for infant feeding and international code of marketing policy, and by monthly submission of electronic database to BPNI National Accreditation Center. We went on implementing the plan by using WHO LAD score for early initiation, WHO recommended breastfeeding history and observation forms, and use of visual tools to demonstrate quality feeding, and key interventions like antenatal education classes and use of breastfeeding support phone line post-discharge was established. This is the plot of electronic database in Excel format tracking the feeding practices as recommended by National Accreditation Center. We repeated the PDCA tool, and to monitor the outcomes, the plot of IYCF indicators, primarily early initiation of breastfeeding within first start, mean exclusive breastfeeding compliance rates at the time of discharge, and at 6 months follow-up were plotted against the implementation months, which reflected a significant increase from pre-intervention through intervention and post-intervention phase. On comparing our results with WHO Global Breastfeeding Scorecard 2023 for developing countries, the Lancet Global Health Observatory Statistics for middle-income countries, and the International Breastfeeding Journal Systemic Review for Future Management Strategies, our results were comparable with the benchmarks published. To summarize, framing the BFHI is an evidence-based change process uses research implementation model that allows us to review and recognize specific essential strategies to benchmark IYCF indicators. These are simple yet cost-effective ways to reduce the risk of infant mortality, and JNHRC could strengthen the institutional breastfeeding policy, establish IYCF monitoring and digital data management system, and facilitate the implementation of international code of marketing of breast milk substitutes. Continuing our endeavor towards quality care, in today's era with over-medicalization of birth, workplace and employment challenges, and with commercial milk formulas exploiting the concerns of parents, this pioneering research benchmarking WHO guidelines marks the beginning of a foundational research with a novel initiative in Central India because we need to catalyze and inspire the best practices. And this is the testimony of our strong institutional commitment to provide quality newborn services. Thank you.
The house is now open for question and answer session.
Ma'am, good morning. I am from Stella H. Balpur, Dr. Vishnu Mukherjee. My question is, what are the challenges that you faced during you proceeded with your study or your program?
Thank you so much, sir, for your question. There were definitely defined challenges like the initiation of breastfeeding in the labor room per se, because we needed to start the skin-to-skin contact in the labor room itself as soon as the birth happened. So that was a challenge because it required a teamwork with the obstetricians and the pediatricians together. And skill training was another challenge. So we kept on doing that, sir, till we could accomplish the goals. We also had a 4-day breastfeeding skill training by national accreditation national trainers at Balai. So we enrolled in quality numbers, particularly those staff who were posted in the labor room or in the maternity wards, and we ensured the use of continuous tools. Second challenge which we encountered was when the mother and the baby were separated, it was difficult to continue the maintenance of the milk expression. So again, with the use of tools and charts, we demonstrated that every mother has to learn this breast milk expression technique, and also the previous concept that the milk is inadequate was washed up with the continuous healthcare staff education and skill training. Initially, the mothers also thought that they had to feed every 2 hourly or every 3 hourly, instead of the recent concept that breastfeeding on demand or on the baby feeding cues is so important. So almost these 3 challenges we had, sir. First, the initiation of skin-to-skin contact in the labor room itself. Secondly, the continuation of milk expression. And thirdly, educating the mothers that they don't have to timely feed them, rather it is breastfeeding on demand, on reciprocal feeding, which is helpful.
Thank you.
Thank you.
Okay, thank you.
Thank you so much. Thank you.